Dr. Dean Vicksman, you're a bigwig in the cat medical field. You retired a few years ago, but you were like the guy, and now you're the head of the Every Cat Health Foundation. So you think you're retired, but you're working harder than ever.
Definitely, without a doubt. Every cat keeps me busy. First of all, I wanted to thank you, Tracy, for having me on. Looking forward to today.
Those of you watching on YouTube, those of you who are lucky enough, I must say, to just listen as a podcast, if you're watching on YouTube, there are a lot of fake cats behind Dr. Dean, and they're quite distracting. They're hilarious, but they're like, I don't know, AI cats, and they're great. And the black one's name you told me is Pickle.
No, Pixel.
Oh, Pixel. That's even a better name. So,
Amazing.
one of the things, as the head of Every Cat nonprofit, head meaning totally all of you amazing docs are volunteer, the Every Cat Health Foundation, one of the research, some of the research that you funded has to do with FIP, feline infectious peritonitis, which I understand is still very much in the cat population, and people find cats, adopt cats, or even have a cat, I don't know, that they've always had and now it has FIP. Can you talk a little about FIP as a disease, and has it been somewhat conquered by modern medicine or not at all? And is the research that you're doing going to change that?
You bring up some really interesting points, and the answer to that is that yes, indeed, we can finally look at cat owners and sit there and instead of walking into an exam room and feeling lost and saying that there's no
Yes.
hope, we can actually walk into an exam room now and have hope for these owners that we can treat and, if not, in many cases, cure their cats with FIP, which is just an amazing thought because 40 years ago that was not the case.
So when you first started out, or in your first, I should say, decades as a vet, was it pretty horrible for you to have to go into that exam room and say, oh my God, I have nothing to offer you. This cat is going to die?
It's terrible. There's just nothing worse. In fact, the majority of these cats that you see, at least back then, are young cats. People just adopted a nice young cat, often
Yes.
from an animal shelter, not always, but often from an animal shelter. And here it is, it's healthy. And a week, 2 weeks later, the next thing they know, they have a sick cat. And you walk in the exam room and there's no hope. And it's just
Yeah.
it's just devastating for those owners.
And they have to
You
basically
know,
watch the cat die, the kitten.
they did. Most of them were euthanized.
They were.
Yeah, most of them were euthanized because they weren't doing well, so they were humanely euthanized. But that was terrible because they adopted what is apparently a healthy cat
Yes.
that's emotionally attached, and then weeks to months later, they have a very sick cat. And there's the other thing that owners had a hard problem with was that there's no human equivalent to this disease in human beings.
Oh,
There's when you talk to owners, often you can discuss different kinds of diseases like heart disease or cancer, and you can
right.
make equivalents with them. And it's easier for people to understand the diseases that their cats get when there's a human equivalent. But when you walk in there and you've got a young cat that has something that they've never seen before that they can't identify, it's really hard for them. It's very
Yeah.
difficult.
And cats get a lot of, is it a virus or a
It
bacteria?
is a virus,
Because they
and
get a lot of viral infections, cats. It's a long
they get a
list.
variety, just like humans do. Again, we can make that same correlation, but they do. They get a wide variety. But this happens to be a COVID virus. And that in itself
Oh,
is where the interest comes in. That
interesting.
FIP is a COVID virus.
Interesting. So, COVID 19, which was the epidemic pandemic for humans, is just one of the many COVID viruses. There's up to 19 or more. I never really knew that. I just thought they called it COVID 19. So, FIP is a form of COVID virus?
That's correct. FIP is a COVID virus. And the fact that we've been studying COVID FIP for the number of years that we've been
Right.
studying it, we were actually way ahead of the human field in terms of our understanding of COVID viruses and actually played a fairly instrumental part in COVID-19 and the treatment of COVID in human beings when the pandemic broke out.
I'll be darned. Now, so that's something I absolutely didn't know. And so, you cat owners who've lost your kitties to FIP, it is heartbreaking, and our hearts go out to you. But the work done on trying to cure them or find a cure has helped people who got a version of COVID. And then there's long COVID, the people who have not yet, or maybe never, will fully recover, right?
Interesting. Yeah. And it appears as though our felines get a form of long COVID, except that they don't exhibit the clinical signs, which is fortunate for the kitties that they don't. But the good news for human beings is that the COVID virus in these kitties could potentially serve as a model for us to better understand long COVID in human beings.
Isn't that's really the purest form of One Health, right?
Correct. In
Between the
translational
two.
medicine,
Yes.
it's come a long ways in 40 years.
So
Um,
talk about, oh, so you had these early years where it was absolutely hopeless. There was no cure. There was not even a treatment. There was simply a death sentence.
Correct. And not only that, when I first got out of school, we used to think that FIP was actually a contagious disease amongst cats.
That's right.
We used to tell owners if they had an FIP cat that they had to sterilize their litter
That's right.
boxes and sterilize their house and they had to wait to get another cat. That's how little we really understood about it. And over 40 years, we've learned a lot. But you think about those owners in the early days. It was terrible. I feel bad for those owners in the early days.
Is how little we knew about AIDS in humans.
Correct.
And what
Exactly
the
right.
contagion was, and that people wore masks and gloves, and it was like lepers. And then Princess Diana kissed a baby that had AIDS, and everyone went, "Oh, I guess it's okay." It isn't the exact same analogy, but there was this sense that you had this toxic cat who,
Correct.
was going to toxify your house and any other cats. And so, who would have ever taken in a kitty like that if they could survive the disease?
No, it was terrible for those owners. And fortunately, our knowledge has come a long ways. And over the 40 years now, we know that we can actually cure many of these cats. And it's not hopeless like it used to be. It's like your cat has FIP. We can actually take your
Wow.
cat, we can cure your cat now. And started off being actually a fairly expensive to treat them. Now that we're doing more and more, it's becoming within reason for many
No
owners
kidding.
to treat their cats
Nice.
for
So the
FIP.
cost comes down as
It
the
has.
drugs get into the system, the medical system, I should say.
It
So
has. It
did
has.
every Cat Health Foundation, were some of the research grants that you gave instrumental in this sea change?
They were, without a doubt. In fact, it was our grants to Niels Peterson back in I think it was the late, like 2017, 18, if my memory serves me, in and around that time, right before COVID, maybe even before that, it was our grants that actually helped him to find out a treatment for FIP.
So that's that. If you had no other accomplishment but that, it's huge. But of
It's
course,
one
you've
of our
had
biggest,
many
we've had
accomplishments.
many accomplishments, I'm sure,
Yes,
as
of
you know.
course.
But
Yes,
this
many.
is a
But this
real.
one people can really relate to because every cat owner's heard of FIP. Unfortunately, a number of people have lived with it and then lost their cat. So, what is the treatment? Is it a particular drug?
They're antivirals. And so antivirals have come a long ways in recent years, and they are actually some of the antivirals, and that's how we're treating these cats.
And that's what people were given with COVID that
Correct.
got COVID?
Exactly right. We're the
I'll be
antivirals.
darned.
Yep.
So now your cat has FIP, which shows itself. What are some of the symptoms? If anyone noticed symptoms and obviously should get to the vet as soon as possible, what are some of the symptoms of FIP?
When the young cats, we usually see what's called the wet form of FIP, and that's a little bit more straightforward. Those younger cats will often come in not feeling well, and they'll have a big old belly full of fluid.
I see.
And that's you can actually look at that fluid, and it's fairly typical for those cats. So that's one of the more common forms that we see. But then there's the dry form of FIP, which is a little bit more insidious and a little bit more difficult to diagnose. And those cats can have just a whole variety of different clinical signs, depending upon the organ system that it targets, because it just depends on where that virus settles out. It can settle out in the nervous system, and then they have neurologic
Really?
signs. It can settle out in their eyes, and they have ocular signs. So it just really depends on where it settles out as to what their clinical signs are.
So that virus is clever.
Yeah, it gets into the immune system. And as we know, our immune system handles all parts of our body, and that's why it can go throughout our whole body.
So it must be quite taxing for a vet that gets this cat presents with a variety of symptoms, any one of which could be something else other than FIP. But is
Very,
FIP your first warning sign, or you think something else like upper respiratory infection? or
Very challenging at times. You're exactly right. Very challenging at times to sometimes get to the bottom of the diagnosis. And sometimes it ends up being a diagnosis of exclusion. You go through this
oh,
and that and have troubles coming up, and you sit there and say, well, this could be FIP. And sometimes you get diagnostic tests that we have that definitely tell you that it's FIP. And other times, sometimes it's you treat them and see if they get better with it.
oh, interesting. What is done with Lyme disease, mostly in
Correct.
dogs, where you
Correct.
aren't sure, so you start doxycycline, and if you lose some of the lameness or whatever other symptom you have, that's
Same.
your,
Yep.
yeah, proof
But
of
that's
concept.
sometimes that's what happens. Other times you do get a definitive diagnosis. You're able to do tests and things like that'll give you a good idea that they have that disease.
So
So
I would just like,
it's a master impersonator of many different
yes,
diseases.
yes. Is feline leukemia similar in the way that it can be confusing to a vet or to an owner, or is it much more clear?
I think it's easier for us to test for feline leukemia than it is for us to test for FIP. So I think it's a little more straightforward with feline leukemia and feline immunodeficiency virus than it is with FIP.
And I'm going to guess that over the many years of Every Cat Health Foundation's research grants, that has also been studied a great
Without a
deal.
doubt, that we have
Yeah.
had many a grant in that arena.
So it's
And
got to be great to know you're part of curing disease. How often do you get to be part of that in modern life?
this is what I enjoy about being on the Every Cat Health
Yeah.
Foundation,
Yeah.
honestly, and just seeing
Yeah.
all this basic research actually come to fruition and seeing the fruits of our labor and like this with FIP and many other diseases. If you own a cat, I guarantee you the Every Cat Health Foundation has granted money that has in some way, shape, or form changed the life of your cat.
That's pretty fabulous because while cats can be the longest lived pet, they also are the ones who are prone to many diseases and need to have many vaccinations and should be seen by the vet probably more often than they usually are because they hate going and therefore the human hates bringing them. And it's great that we now have cat friendly practices, which does help. But not everyone's even aware that their vet clinic may have gotten that accreditation. So they're still thinking that they're going to be mauled by dog breath when they come in the door.
Well, the good news, honestly, is I've seen that's another big change I've seen in my career over the 40 years is the value of cats. The value of cats
Yes,
has just
yes.
gone up, and it's unbelievable what's happened, especially in the past 5 to 10 years, and how cats have just become such a part of our society.
Yeah, instead of being disposable. I hate to
Correct.
say it, but there was a sense that cats, if it's not used in the litter box, I'm not going to go to the vet and find out if there's a medical reason, or does it have to do with how I'm preparing the litter box or where it is, or other cats. I'll just open the back door. He'll go find another place to live.
You know,
That was a thinking.
I was pretty active in the animal welfare community here in Denver. And it's amazing how, when you look at our shelters and our cat population and our dog population, even now there's times where it's harder to get a cat sometimes than it is to get a dog, which
Yep.
is just
I live in Vermont, and they were doing trades with the shelter in Southampton on Long
correct.
Island. They didn't have any cats. Can you send me some cats, and I'll give you large black dogs because we have some of those that are the least desirable in a shelter. Can you
Tracy,
take?
a day that we dreamed of 40 years
Yes,
ago,
yes,
even
that's
20
right.
years ago,
That's
a
right.
day that we dreamed would never happen, and here we are
Yep.
today.
I want to say that part of that is not only the research that Every Cat Health Foundation's done to elevate the status of cats medically, but also I think the Fix by Five campaign, every
Yep,
cat should be spayed or neutered by five
yep.
months old so they don't reproduce. It resonates with people because living with an intact cat, male or female, is nightmarish. It's
It's a
horrible,
challenge. Yeah, it's a
right?
challenge.
Whereas spay neuter with dogs, it can be pushed out further. People don't really get it, and but we never had stray populations of dogs in most of the United States in the last 50 years. But we did of cats, and between the TNR taking care of feral cats who they then spay and neuter and vaccinate and let them live out a healthy life in a community, it really is it's a testament to all the work being done on behalf of cats that there aren't that many for adoption. Yay.
Yeah, we're in a much better place than we were 5, 10,
Exactly.
15 years ago. And
Well,
again, a place that we never thought we'd be.
yeah, which you're right. That's a very happy thought. And thank you for retiring and then going back to work for free. It's
Oh, it's
really
my
great.
pleasure. I enjoy it
Uh,
so much.
It's great to know more about the Every Cat Health Foundation. I know you'll be back with news of other diseases and other illnesses that you guys have given grants for that have come up with really wonderful results. So thank you for all the
Thank
work
you
the
for having me,
organization's
Tracy. It's
done
been a
for so
pleasure.
long. And to you as well. Take care, Dr. Dean.
Thank you.
Bye bye.